everyone. We have learned the common fractures of the wrist last class, and then we learned the common soft tissue injury of the wrist. It is mainly divided into tendinosynovitis, sickle cyst, carpal tunnel syndromes. First of all, let's take a look at this picture. In the picture, the patient has pain in the radial side of his wrist. What's the problem? It's the first knowledge point that we should learn, that is radial styloid stenosine tendinosynovitis. This disease occurs frequently in middle-aged people and is more common in women. Anatomically, we mentioned that the radius styloid tendon sheath is a common tendon sheath of abductor pollicis longus and tendon of extarsal pollicis brevis. In daily work, there are mainly some operation and extension flexation movements which make the abductor and extensor of the thumb contract constantly, resulting in aseptic inflammation and stenosing tendinosynovitis in this area. Let's analyze the etiology and pathology. This disease is mostly caused by chronic accumulated injuries. Long-term overstrain of wrist can lead to the occurrence of this disease. For example, the work done by housewives and manual workers makes the tendons of musculus abductor pollicis longus and extensor pollicis brevis frequently move back and forth in the common tendon sheath. And the long-term strain can cause traumatic inflammation of tendon sheath, resulting in congestion and edema of fibrous canal, sinking of sheath wall, narrowing of lumbar, sinking of tendon. The tendon has difficulty sliding in the lumen and occurs corresponding symptoms. Patients with weakness and blood deficiency in traditional Chinese medicine are more likely to have this disease. If local lesions prolong for a long time, the tendon sheath is fibrous and contracted, and the tendon sheath cavity becomes narrow. The symptoms will become more intractable. Clinically, the disease is more common in middle-aged women or pregnant women, and its onset is slow with pain in the radial side of wrist. You will feel lacking of power when lift weights, especially you can't do such actions as lifting poles and pouring water. There are protuberance or nodules in the belemnoid part of the radius, and there is pressing pain between the belemnoid of the radius and the base of the first metacarpal bone. Some patients are reddish, slightly swollen, and slightly hit locally, and pain can radiate to the hands. The first clinching test is positive in special physical examination. In some patients, pain can occur when the thumb is adducted, and the pain is aggravated with ulnar deviation. Once diagnosed, radial styloid stenosine tendinosynovitis is dominated by non-surgical treatment, mainly acupuncture, massage, oculophthalmology medicine. The oculophthalmology is a very common and effective treatment for this disease. When the treatment fails, tendon sheath lysis is feasible. Next, we will learn another kind of tendinosynovitis, namely tendinosynovitis of hand flexor tendons, which is also a very common clinical tendinosynovitis type, also known as stuck finger and trigger finger. It usually occurs in the thumb, but also in the index finger and middle finger. In a few patients, it occurs with multiple fingers at the same time. A tendon sheath of digital flexor tendon is a bony fibrous canal composed of the superficial sulcus and sheath ligament of metacarpal bone neck and the palmar metacarpal phalangeal joint. The flexor longus pollicis tendon, flexor digitalis profundus tendon, and flexor digitalis superficialis tendon respectively pass through the corresponding canals and into the thumb and fingers. The disease occurs when local labor is excessive or when people catch a chill and chi and blood cannot nourish the apneurotic system. Frequent finger flexation and extension activities and long-term holding of hard objects make flexor tendon and bone fibrous canal rub and compress repeatedly. The bone fibrous canal is compressed by hard objects and metacarpal bones, which cause the local congestion and edema of the bone fibrous canal, and then degeneration of the fibral vascule, which makes the lumen narrow. The flexor digitorum tendon is compressed and thinning in the narrow lumen, and its two ends enlarged into a gourd shape. When the fingers are flexed, the enlarged tendon is blocked from passing through the narrow opening of tendon sheath, which limits the flexation and extension activities. When the affected fingers are flexed or flexed passively, the trigger-like bouncing action will occur, accompanied by a bouncing sound. The clinical manifestation of the disease is very characteristic. At the beginning of the disease, the patient's finger cannot stretch and flex, and pain will occur when stretch and flex vigorously, and the bounce action will occur. The symptom will be served in the morning, after work and after cooling water, and the symptoms will be relieved after activity or hot compress. There is significant tenderness on the faces, vertices of the metacarpal bone, and the right-side nodules can be touched. The nodule here is pressed, and the patient is advised to do sufficient flexation and extension activities. There will be significant pain and hear a bounce sound. Because of the limited extension and flexation, it brings inconvenience to work and lift. Several patients cannot straighten their fingers on their own after flexation and need healthy hands to help them straighten. This disease is usually treated by comprehensive methods such as manipulation, acupuncture, and occulophthalmology. When tendon regulation is performed, the thumb performs pressure lift and planking, passing laterally, and pull tendons longitudinally. In acupuncture treatment, acupuncture at the nodule and its surrounding pain points is often taken once every other day. Blocking therapy can also be used once a week 2 to 3 times as a course of treatment, and the curative effect is satisfactory. Of course, stuck finger can also be treated with occulophthalmology therapy. In terms of prevention and nursing, patients should do hand movements slowly to avoid fatigue and use less cold water to reduce local irritation. For patients with short onset time and severe pain, it is necessary to have a full rest, which is conducive to the recovery of injured tendons. Tendon regulation should be performed properly, and rows with significant late hardening nodule should not be used as far as possible, so as to avoid the opposite effect. Blocking or occulophthalmology therapy can be used. It is also a tendon sheath. Besides tendinosynovitis, there is another kind of disease prone to tendon sheath. Please look at the back of the hand and dorsal feet of the patient in the picture. This disease of the tendon sheath that tends to occur is characterized by the appearance of the mass and the lack of obvious pain. So we called it cyst, which is cystic mass occurring in the joint or tendon sheath and contains colorless, transparent, or slightly white and yellowish thick frozen macules. It's called wrist tendon knot, wrist tendon tumor, tendon gathering, and tendon knot in ancient times. It may occur at any age, especially in young and middle-aged people, with more women than men. Cyst is mostly caused by strain. The cause of cyst formation is related to retrograding. The ecosystem is closely connected with articular capsule or tendon sheath, but not necessarily connected with synovial cavity of articular cavity or tendon sheath. Cyst often grows slowly with no conscious pain in most cases and local swelling pain in a few cases. A hemispherical eminence can be seen locally. The mass protrudes from the skin. The surface is smooth, the skin color remains unchanged, and feels cystic. It is not connected with the skin, the surrounding boundary is clean. The base is fixed or movable when it is pushed, with slight or no tenderness. After long-term chronic inflammation stimulation, cysts in some patients become thick and hard, even reach a degree similar to cartilage. Cyst can also be seen in the back and the popliteal fossa of ankle joint. In the popliteal fossa, a mass as big as an egg can be seen when you stretch your knee, and it is deep when you bend your knees, which is difficult to touch clearly. The treatment of cyst is relatively simple. Manipulative therapy is the main treatment, combined with the acupuncture and medicine, and surgical treatment is feasible when necessary. To the manipulation, for those with short onset time, thin cystine wall, and significant cystic sensation, the cystine can be pressed directly. For those with thick cyst wall, unbreakable cyst content with little tension, acupuncture can be used. Surgical resection is possible for repeated cases. Okay, the above is the learning content of wrist and palms of tissue injury. Here, we have collected all knowledge together. You can review from it. So, thank you very much and see you next class.